Welcome back. Now, stroke is a very ancient disease. It was first described around 2000 BC and then again in 400 BC by our friend Hippocrates, who actually detailed the manifestations of stroke clinically. And he described it as something very violent and very sudden, as in sudden paralysis. Now, what is stroke exactly? It's when parts of the brain do not get the blood that it needs. This can either be ischemic, which means that the blood vessel is clogged or clotted and not enough blood is going to the brain, which happens in the majority of patients, about 90%, or it can be hemorrhagic, where the blood vessel actually bursts and causes a bleed in the brain. Another name for stroke is cerebrovascular accident, or CVA. Now, stroke is a very common. In fact, some studies show that 1 out of 4 adults will get a stroke in their lifetime, and it is one of the top 5 leading causes of death for at least 10 years or more. As far as how does a stroke present? Well, it presents very suddenly. So remember back to what the Greeks were describing. It's a sudden paralysis, a sudden facial droop, a sudden trouble walking, speaking, talking, balance, etc., a sudden vision loss. Less commonly are headaches and vomiting and loss of consciousness. Now, the risk factors of stroke, we've actually learned a lot of these. Anytime, if you think about it, anytime that the blood vessel is more narrow because there are deposits on the sides of it, or if the blood vessel itself is being overwhelmed because of the high blood rushing at it, there is an increased risk of stroke. So by far, the biggest increased risk of stroke risk factor is hypertension. And in fact, if patients can even decrease their blood pressure by a few points, their risk of stroke goes down by a lot. Smoking even 1 cigarette a day can increase the risk of stroke. Hyperlipidemia, high cholesterol, can increase the risk of stroke. And diabetics will get stroke about 2 to 3 times more than people who don't have diabetes. As far as the diagnosis of stroke goes, studies have well documented that the earlier the stroke can be recognized and the faster it can be treated, the better the long-term outcome of the patient. And faster meaning like within a few minutes to a few hours. So even though it's been over 2,000 years, stroke still remains a clinical diagnosis because different parts of the brain control different parts of the body. So when the patient comes in and let's say they have an arm weak or a leg weak, you can tell where in the brain the problem is and then kind of go from there. And then there are scans like CAT scans and MRIs, etc., that can confirm the diagnosis, and then ruling out other things like heart attacks and seizures, etc. Because it is a clinical diagnosis, and especially within that first few hours to minutes, stroke can be missed very easily, and it can also be overdiagnosed very easily. When it comes to treatment of stroke, the first and probably the oldest treatment is aspirin, because aspirin makes those blood cells a little bit more slippery, so they can kind of slip through the narrow cracks in the blood vessels that are working. There are other medications that also help, certain blood thinners, and some of them can act within minutes to seconds to open up a blood clot. There are certain procedures, again, that can go into a blood vessel in the brain and open up the blood vessel if it has been clotted. There are surgeries inside the brain, for instance, if there's a bleed in the brain, to help get rid of the extra blood so that the brain can start to heal. There are surgeries outside of the brain, so sometimes the pipes of blood going up, like the carotids, are all filled with cholesterol, so cleaning them out reduces the risk of stroke as well. And then managing blood pressure and diabetes and cholesterol and stopping the smoking. Diet is very important, especially diets that are low in red meat and avoid dairy. And then physical therapy, which we will definitely get into more later. As far as the long-term outcome of stroke, again, the sooner it is recognized, the sooner it is treated, the better, but it's still a very deadly disease. In fact, 30% of patients who have had their first stroke will die within the first 30 days, and 75% of patients will have a disability. But knowing what we know today, stroke survival and quality of life after survival is much better than even 30 years ago. And most importantly, what has been recognized is that recovery in stroke involves more than just the physical part of it, but also the emotional and the mental part of it. And take it from someone who knows, it's a very hard journey. It's a lot of hard work, and it can be very painful at times, but it is definitely worth it. As Gimli said, faithless is he who says farewell when the road darkens. Until next time.